Hello and welcome to The Arise interview. 60 minutes of big questions about the big stories from the news and beyond, with fresh insight and critical analysis. I'm Charles Aniagolu. Coming up in the next hour, as countries around the world bring in tough new measures to restrict the movement of people, and as the number of cases from the coronavirus passes 200,000 globally, Nigeria has become the latest African country to impose a travel ban after an increase in those infected with the disease. But how effective will it be in dealing with the sheer scale of the problem that's sweeping through the world? Also, in the midst of the global coronavirus pandemic, medical doctors in the Nigerian capital Abuja have embarked on an indefinite strike, saying they haven't been paid for more than 2 months. We'll speak to the president of the Association of Resident Doctors in Abuja. And later, as the first recorded death of the coronavirus in sub-Saharan Africa is confirmed in Burkina Faso, healthcare experts are warning that the combination of conflict, humanitarian crisis, and a strained public healthcare system could quickly overwhelm the Sahelian country. All this coming up in a moment. So it's lockdown within countries and increasingly lockdown between countries because of COVID-19. Until now, the coronavirus has been slow to penetrate the African continent, buying African governments valuable extra time to prepare. But it's here now and it's gathering momentum. And so the continent braces itself for the virus, but amid resolute worries, it is in places reasonably well prepared, but overall acutely vulnerable. Nigeria, which has been praised for its past efforts at stopping the Ebola disease, has joined the list of countries bringing in tough new measures to restrict the movement of people. It is to ban foreigners from any country where there are more than 1,000 cases from entering Nigeria. The ban takes effect on Saturday for 4 weeks. It comes after an increase of those infected. There are 5 new cases that have tested positive for the coronavirus, bringing the total number in Nigeria to 8.
The federal government of Nigeria is restricting entry into the country for travelers from the following 13 nations: China, Italy, Iran, South Korea, Spain, Japan, France, Germany, Norway, the United States of America, the United Kingdom, Netherlands, and Switzerland. These are all countries with over 1,000 cases domestically. All persons arriving, number 2, all persons arriving in Nigeria who might have visited these countries 15 days prior to such arrival will be subjected to supervised self-isolation and testing for 14 days. The federal government is, number 3, the federal government is temporarily suspending the issuance of all visas on arrival. Number 4, the federal government is also counseling all Nigerians to cancel or postpone all non-essential travels to these countries. And number 5, the federal government urges public health authorities of countries with high burden to conduct diligent departure screening of passengers and also endorses travel advisories to their nationals to postpone travels to Nigeria. And fourthly, these restrictions will come into effect from Saturday, 21st of March, 2020, and it will last for the following 4 weeks, subject to review as the situation unfolds.
the Secretary to the Government of Nigeria there. Well, for more on the rise in new cases of COVID-19 in Nigeria and the travel restrictions imposed by the Nigerian government, I'm joined now in the studio by the Senior Medical Officer with the Nigerian Government Administration in Abuja, Dr. Nnadozie Chinedu-Alexander. Thank you very much indeed for coming in. Nigeria, of course, announcing 5 new cases of COVID-19, bringing the total to 8. All 5 cases apparently had a travel history to the UK and the US, according to the National Center for Disease Control. What are your thoughts on that? What do you know about that?
Yeah, earlier today I saw the news, I saw all the posts about these 5 new cases like every other person. And it's not surprising because usually in outbreaks like this, it gets bad before it gets good. You see a few numbers, you definitely know that the numbers are going to rise. So especially if there are no such restrictions, such travel bans. So seeing those 5 new cases, and when you see 5 new cases, these are tested cases that we've seen to be positive. It is possible that there are some that have not been tested yet. As well as other countries that have mentioned the figures they have, it's for those cases that have been tested. So as far as our airports are open for people to be coming in, definitely we expect to see cases. And because these things, you may not have symptoms. For about 60% of those who get infected, you may not have symptoms. So they can just, and you go to airports and you see people with this thermometer checking the temperature may be very normal. And then the person passes through only to go home and then start getting some symptoms and start calling NCDC or the Ministry of Health. So if that is the method, then the numbers are going to rise, except for the ban that has come now, of which there may be the good sides and bad sides to it.
Now, what I want to get from you as first of all, a medical practitioner, but secondly, as someone who is part of the government administration, the healthcare system in Abuja here. What is your sense of the level of preparedness in Abuja?
Well, since it broke out in China, and especially earlier in January, mid-January throughout January, we have been doing sensitization. Of course, in our facilities, we have what we call CME, Continuing Medical Education, that happens in a fortnight, where we pick up topics and seasoned people come to discuss it because it's part of how we get our medical licenses renewed every year. So COVID-19 and of course the ongoing Lassa in the country have been discussed by the experts from infectious disease control. So they have come, and then there's been training about how to use the PPEs, the personal protective equipment and all that. And of course we were informed of the lab that can test for it by NCDC here in Abuja, and then some other states that have it, so that if we have any case, the channel for which you can, send your information, people you can call when there are such cases. So there's been such sensitization, and the PPE is delivered a few numbers of which you can make a call if you need more, depending on the cases you have, and they're just around, they can bring it. So for Abuja, we may say that there is some level of preparedness, but
some level
of preparedness. Yes, of course, because I can't sit here and say it's 100%, but the portal of entry.
So what's the percentage that does not inspire you?
Well, the training, because it's not just about the hospital. So if everybody that is supposed to get the training and for sensitization to go into the society and give enough sensitization to put it in the news, to put it on billboards and all that, what people are supposed to do. Not everybody has access to social media where all these things are there. So if the sensitization goes all around, and to tell people not to stigmatize, so that people cannot hide when they feel some symptoms, when they have come back from one of those countries, or when they've come in contact with people who have come back. So if people have all this training and know that this disease, because what we hear in the news is as if it's get it and die thing. It's difficult. We don't really hear how many people have survived and all that. So when people get this, they feel like virus, another HIV. So they don't want to tell people, they want to hide it. So, but if the sensitization has gone around the city as it should, then we know that the level of preparedness has increased. So even if somebody is coughing, you don't want to go close to the person because of what you've been told, but you're picking up your phone to make a call instead. If you know the person has come back from China or the UK or wherever, they have more than 1,000 cases. So you see that people are aware, and people can even help you because the NCDC, the Ministry of Health cannot be everywhere. But if people are well informed, the primary health care centers are well utilized to have the PPEs as well, not just the other secondary health facilities and tertiary. So that is when I can raise the percentage high to say we're really, really prepared. But at our own level, where we work secondary facilities and tertiary facilities, there is the preparedness, but that might not cover up to 50% of people in Abuja.
And in terms of the anxiety that you might experience as a medical practitioner yourself, is that anxiety eased by the fact that Nigeria has imposed a travel ban on a number of countries? I mean, what is your feeling about the key points of that ban?
Well, before we got coronavirus from countries that probably didn't have up to 1,000 cases by the time we got them. I don't know, I wasn't sure of how many cases Italy had before we got from them, and now we have from the UK and maybe the US. So the number 1,000, people have been banned. The countries that have been banned are those ones that have up to 1,000 cases. So the ones that don't have up to 1,000 cases, our airports are open for them. So how safe are we to have such people coming?
That's a good point.
You know, so except because the way I was looking at this ban, if China, for example, that the whole thing started from, had their own ban, an internal ban to say everybody living in China don't go out.
Right, and also that they're going to lock down the entire province of
exactly,
where it took place.
That is a better ban. And if
Hubei.
union of countries like the United Nations, like the Commonwealth, like the African Union, all have this unity amongst themselves, and to say your country has more of this, we will give our support, maybe financially or whatever, but please, can you lock down your city? Let them not come in. We saw what happened in Ebola. Other countries were locking down, and Liberia had to cry out that people are locking them in, so they're going to implode. So that was one of the downsides of everybody locking in. So except countries that have this kind of do some lockdown within them, so that nobody really who has it goes out. And I have a particular theory about airline companies and how they can help, instead of even looking at the national lockdown or restrictions. It is the airplanes that carry people from one country to another, and maybe trains in the Europe and the Americas or what have you. But airplane companies especially. If, for example, let me use the British Airways for example, and they make sure that all the people that book the flight book within days and not just buy tickets and travel, book ahead of time, and get them maybe 48 hours before they fly to your office, because individuals don't know where to go and test. You know, you only hear of testing when somebody is suspected and all that. But you hear about athletes who are not even having symptoms and they are tested because they have the links. So the airplane companies can have these links. So they can arrange for testing for the passengers who have paid for ticket. If they like, they can charge from that ticket money for testing.
So let me ask you to just hold that thought. Very interesting. We'll come back to you in a minute. You're watching the Arise interview. Plenty more still ahead as we continue our chat about the rise in the number of coronavirus cases in Nigeria and the travel ban imposed by the country. Stay with us. Welcome back to Arise interview. I'm Charles Anyagogo. As you may have heard, Nigeria has placed a travel ban on people coming from 13 countries worst affected by the coronavirus outbreak, as 5 new cases were recorded in Africa's most populous nation. That brings the country's total number of patients with COVID-19 to 8. Nigeria's Health Minister Osagie Ahanire said contact tracing for the new cases was ongoing. All the 5 had travelled to the UK and or the US. Travellers from China, Italy, Iran, South Korea, Spain, Japan, France, Germany, the US, Norway, the UK, the Netherlands and Switzerland will not be able to come into Nigeria from Saturday, the 21st of March. Nigerians have also been advised to cancel or postpone all non-essential travel to these countries, which have all reported more than 1,000 cases of COVID-19. On Tuesday, the government also banned indefinitely all public officials from embarking on foreign trips.
The Presidential Task Force for the Control of Coronavirus, COVID-19, has announced the following interventions on the 17th of March and also this morning. First, the prohibition of travel by all public servants. Secondly, the suspension of the visa on arrival policy until further notice. Thirdly, a firm travel advisory to Nigerians against non-essential travel to high-burden countries, especially in view of the number of Nigerians who have arrived from the US and Europe and diagnosed in the past 48 hours with coronavirus infection. Number 4, a requirement that all persons returning from overseas will self-isolate for observation for 14 days, even if they feel very well. The NCDC will disseminate information on the practice of self-isolation. Number 5, a supervised self-isolation, including testing of persons returning from nations with community transmission of more than 1,000 cases cumulatively for 14 days, will be conducted by the Nigeria Center for Disease Control and Port Health Services.
Nigerian Health Minister there. And with me in the studio, the Senior Medical Officer with the Nigerian Government Administration in Abuja, Dr. Nnadozie Chinedu-Alexander. Thank you very much indeed for staying with us. And you were making a point before we went on break.
Yes, I was looking at how the airline companies could help the whole
Yes.
world curb this spread of coronavirus.
In the wake of the travel ban
Yes, in the
that
wake of the
Nigeria
travel ban.
has imposed.
Yes. You see, with this travel ban, airline companies are going to lose money, a lot of money. But if before now, and even going forward, they had considered all the people that booked to travel to Nigeria, for example, from the UK or wherever, you invite them to your office, maybe 2 days before they are due for their trip, and you test all of them. All the people for a particular flight, you test all of them. The result should be out before the end of the next day. The result is out, you allow only those who are negative to travel. You quarantine those who are positive. You are helping to find out, you're helping the nation that they're coming from to get the number of cases, and you're making sure you're not exporting the virus to any other country. Now, and you give them their results, so that, or you make it known to the government of the people where they're going to, so that by the time they are landing, you know that this flight is not carrying any coronavirus patient to this country. Okay, and then if all airlines, those come from Nigeria are going elsewhere, they're doing that, those coming in from Nigeria are doing that, if they had started doing it before now, I don't think we would have had this exporting and importing of the virus.
You have a good point there. Obviously, it's the logistics, it's the cost, it's so many things. I mean, the airlines are not, they're not sort of healthcare facilities, but you have a point in the sense that when you've got a crisis like this, you need to come up with measures that are extraordinary. For example, when the issue of terrorism became a big problem globally, and I mean, you had 9/11 in America and so on, there were certain restrictions that were imposed on airlines and things that were required of them. The checks they had to conduct and all that sort of thing. So possibly the point you make have some merit. But the question is there communication between you within the Abuja Medical Healthcare Administration and the national government, as well as the administration where you work?
Regarding the coronavirus?
Well, regarding healthcare in general. In other words, is there a conduit via which your ideas and your suggestions, I mean, you're the senior medical officer, so you're not somebody trotting off the street. Presumably what you say is taken with much more than a pinch of salt.
Yeah, talking about my position in FCTA, there are countless senior medical officers there. It's just the way you rise in the civil service. Okay, so but that doesn't mean that my opinion doesn't count. So we have channels, just like the Association of Resident Doctors. We have our meetings, and whatever is discussed in our meetings, will be carried on. We have a communique from every meeting, and then we have such CMEs where we discuss these things, and we have all these meetings where we discuss, but we've not had any since I started thinking about this idea with the airline companies, which was yesterday. So,
right. But let me ask you this then. In terms of detail, what are your thoughts on the method of detection? Because I assume a lot of these people pass through the airports where you know, there are people sort of in charge of health activity there, even though I understand that one might have come through the land borders. What are your thoughts on the method? I mean, beyond what you talked about, the airline and so on, your thoughts on the way that detection takes place? Because what I understand, and your expertise as a medical person and someone who's probably more knowledgeable than the rest of us is quite important here. What I understand is that many people could easily pass through the airport and have their temperature taken, and it just would not reveal that they have any symptoms at all.
Yes, exactly. And the method of detecting this virus, we really need to know. Unfortunately, it's not what you can comfortably just institute in every airport, you know, in Nigeria, for example. Because the testing, there's what we call reverse transcriptase polymerase chain reaction, which is what they do to detect this virus and some other viruses. Now, you can't have such equipment and have enough of them to keep everywhere and have all the expertise to run it and test these things. So the temperature check is to identify those who are sick, because fever is one of the symptoms for when the body is breaking down, you know, in a lot of cases. So it might not be COVID-19, it could be anything, but it helps you detect people who are sick, and then you go check them.
Yeah, but the point is that the fever takes a while to manifest.
Yes.
Even though the virus is already inside you.
And for some, it might not even manifest. You know, so that is why you can still have people pass through the airport, and we have the condition in our country, even though there are checks going on at the airport. So the information is very important, because they have to take your blood and send it to a center. In Abuja here, we have a center, I think close to Gudu, where you take it and then they run it through the machine for another 24 hours before you get the result. So you see that people landing at the airport, you can't subject them to have to wait for their result before they enter the country fully. So it's not just going to be possible to do that. So to telling them to self-isolate is very good, but to check them before they even start coming to the country might be better.
Yes, I see what you mean.
Yeah.
But would you say that Nigeria is learning better how to manage this new disease?
Yes, I think from the facilities Nigeria has been able to put in place since the time of Ebola, so it is easier to just continue from where you stopped. And then because we've had Lassa with us for a long time, these are dangerous viral diseases, so handling all these conditions has made Nigeria a little bit more prepared. We've not always had the NCDC, okay, but now we have the NCDC.
That's the Nigerian Centers for Disease Control.
But now we have them, and they are the central point in all this, okay? They've brought a lot of facilities, and they are coordinating very well with the Ministry of Health. So we are better than where we would have been some years back.
Right.
Okay, we are not yet there, we're not where we should be, and luckily for us, we do not have as many cases as other countries now have, and learning from other countries' mistakes here and there, we can prevent ourselves from having as many cases as they have.
Well, certainly one thing that African countries have done, and maybe because they are worried because of their weak healthcare facilities, I mean, is that they've taken more stringent measures a lot earlier than European countries, for instance, did. And maybe that is something that will stand them in good stead. But Nigeria so far has had no mortality from the disease. Are you encouraged by that? And why do you reckon there's been no deaths yet?
Thank you, and it is very important to let the public know that, so that it won't be all panic. So from what we've heard in the news, all the people from the Italian man to his first contact to the third case, we've heard that they were doing so well. Okay, so you would know that this virus is not a death sentence. Okay, now they've been saying it over and over again that for those who have comorbid conditions, who have other illnesses like the heart, like the kidneys, you know, like some other issues, especially the much older people, that it could be a more serious situation with them. But that doesn't mean that it cannot affect the younger people, cannot kill the younger people. We've heard how some young people who have died from it. But this is good news so that there will be no panic. Okay, so that people will calm down. Without anxiety, we'll be able to remember what we are told to do. If you are anxious about it, somebody is just coughing by your side, in attempts to jump away, you can even fall on the person. But if you're not anxious, you carefully know what steps to take. I do this, and I do that. So it's very important. And then I think, yeah, we've not had any death, and I pray we don't have any death because of the proactivity. There's been that proactive nature. And I'm glad that most people fly into Nigeria through Lagos, and Lagos has the budget, the willpower, many things Lagos has to be able to fight.
But even if Nigeria, as you suggest, is on top of it and appearing to react very quickly, I mean, this rise in the number of confirmed cases just shows that this virus can keep growing and keep coming back, which is why drastic measures are needed, and possibly for a very long time.
Yeah, I'm not insinuating that Nigeria is completely on top of it.
Right.
Okay, Nigeria is doing something, maybe not the best so far, because if it can pass through at all, then something can be done, and human beings are the ones to think of what to do to make sure it doesn't pass. So we're not really on top of it. But then, as we know, it is by testing that we find out. And because we cannot test 100%, then we may miss some.
Right.
And then eventually find out.
Okay.
So the numbers will grow before they come down. And that is how it's been in all the countries.
Dr. Nnadozie Chinedu Alexander, I want to thank you very much indeed for coming in.
Thank you for having me.
Good to talk with you.